In today's society, many people are suffering from a relatively newer disorder known as anorexia nervosa. Anorexia is an eating disorder in which a person becomes overly self-conscious about their bodily image and begin to obsess over their weight and food intake. It is usually categorized by someone not being able to maintain a weight that is within 15% of their ideal size. The image they have of themselves becomes distorted and they begin to see themselves as obese even when they are underweight. Even though anorexia was not common before the end of the 20th century, people have always suffered from eating disorders such as itself. Emily Deans, medical doctor and evolutionary psychiatry, talked about the early history of anorexia in an article that was published on a website entitled Psychology Today. In her article, Deans stated, "The first descriptions of anorexia nervosa in the Western world date from the 12th and 13th centuries. Most famously, St. Catherine of Siena, who denied herself food as part of spiritual denial of self." Through her article, Deans provided the general public insight into some of the earliest findings on this disorder. She also went deeper into the study and noticed that cases of anorexia began to increase on into the 70s and 80s. Scientists have yet to determine the cause of this disorder, but have found that it seems to be common among those that have a family history of weight problems and other health disorders. It seems to normally begin in teens, most commonly in females, most likely due to peer pressure and self-confidence issues. The National Alliance on Mental Illness says that conservative estimates suggest that 0.5% to 1% of females in the United States develop anorexia nervosa. Because more than 90% of all those who are affected are adolescent and young women, the disorder has been characterized as primarily a woman's illness. It should be noted, however, that males and children as young as 7 have been diagnosed, and women 50, 60, 70, and even 80 years of age fit the diagnosis. Some of these individuals will have struggled with eating, shape, or weight in the past, but new onset cases can also occur. The disorder tends to start off as a diet. It then progresses into something more serious, such as an obsession, as one becomes scared of gaining weight as his or her self-image becomes more and more distorted. These are certain symptoms, both physically and mentally, that characterize this disorder. A person with anorexia will begin to experience a thinning in the hair as well as a yellowing to their skin. They will also look malnourished and become dehydrated. They will begin to develop a distorted bodily image of themselves and deny their hunger because of fear of gaining weight constantly taunts their minds. Depression can also be a defining symptom when noticed along with others. Anorexia can also take a more devastating toll on a person's health in the long run. It can lead to anemia, kidney problems, lack of menstruation in women, low testosterone in men, and even heart problems. Even though it may seem like it would be hard to turn a disorder such as this around, there are treatments available. According to the website of National Alliance on Mental Illness, individual therapy is the standard treatment used for recovery. A person's coping skills can be helped through a therapy entitled DBT, or dialectical behavioral therapy. Cognitive behavioral therapy is a treatment that is used to help with the unhealthy behaviors and thoughts of the patient. Group therapy and family therapy are two other treatments that are commonly used in rehabilitating a person affected by anorexia. Even though all these options are available, extensive studies have shown that only about 1/2 of those that suffer actually recover. One scholarly journal that I stumbled upon recently was about research involving deep brain stimulation as a treatment for this disorder. Neuroimaging was used to show that patients in the acute phase of anorexia nervosa had reduced brain volume and enlargement of the cortical sulci and ventricles. The studies conducted on this theory used deep brain stimulation between 2010 and 2013 produced positive results. The deep brain stimulation was able to reduce maladaptive activity and connectivity, the stimulated response to restore the disease. The networks to a healthy state, anorexia and related psychology in many ways. Even though it affects the body, it is also a disease of the mind. As previously explained, anorexia can cause a person to have a distorted mental image of themselves. Their mind is playing tricks on them and causing them to fall victim to this disorder. In my opinion, this eating disorder is not one to be overlooked and thought of as just a cry for attention. It should be taken seriously and treated as such. Bodily image is a topic that is important to everyone in this day, and just as it was many years ago. This disorder shows just how far society has taken the expression beauty is pain.